First of all, I want to talk about the patient population that we studied, which is a relapsed and refractory multiple myeloma population. They had to have at least 3 prior lines of therapy and been exposed to IMiDs and proteasome inhibitors. They also had to have at least 50% BCMA expression in their bone marrow plasma cells. So with this population, these are hard to treat people, and so that's why we were interested in getting these people into this therapy that we thought would be very efficacious. So far, we've treated 12 people, and we've been able to see that the safety is what we would expect from this type of therapy. 2/3 of the patients had CRS, or cytokine release syndrome. Most of this was grade 1 or 2. 1 person had a grade 3 event. Regarding neurotoxicity, there were 3 patients who had neurotoxicity, 2 of which were grade 1 or 2, but there was 1 grade 4 event with encephalopathy in the setting of a grade 3 CRS. This did require us to expand the dose level, and we actually ended up treating another 6 patients at this dose level. And the reason for that was that we wanted to see how much high versus low tumor burden may contribute to the safety signal. That is, do patients with greater than 50% plasma cells in their bone marrow have more chance of having a toxicity? It turned out that the rest of the patients did great, and there were no other DLTs, so this looked to be an isolated event. Regarding the efficacy, it looks like we have 83% of patients responding, which is 10 out of 12. Now remember that this is the first dose that's being tested in this phase 1 trial. Some of these responses actually took a while to evolve, meaning that over time the responses deepened. In addition, the patient that has been longest followed up so far remains in remission at greater than a year, but we do need longer follow-up to understand the full efficacy.